Good afternoon, everyone. Talking on two topics, both mine as well as Dr. Sayan Basu, who's my colleague who could not make it due to a personal emergency. So, what basically I want to pass on as information to the audience is understanding of four terms that one might come across if one is trying to read ophthalmic literature. Now, two common things, though all of us would be busy in our practice, two common situations that you might come across is somebody gives you an interesting article, see so and so drug has come into market, it is really working well, these are the results. Or a pharma person coming to you with a very nice glossy pamphlet and says this is our new anti-glaucoma drug and this is the study that we created, we gave the medication in 5,000 patients and look at the p-value. There is something called as p-value which they will harp on, that it has come out to be significant, ये drug बहुत ही अच्छा है, इसको अब शुरू करना चाहिए. So when we don't have, none of us is a biostatistician, right? We are all clinicians. So if we are not biostatisticians, what basic knowledge should we have to at least be sure that whatever information that person is giving up, is it just a marketing gimmick or it is something which is good enough for you to change your practice pattern? So to understand that, there are four basic terms which we need to understand. If we understand these four terms, and whenever some literature is put in front of us, if we try to search for these things in the given article, or whenever the pharma person is coming to us, we demand him to give us information on these 4 points, we will be in a better situation to understand, fine, whether I require to imbibe this therapy in my clinic or I don't imbibe. Right? So we talk about p-values, confidence intervals, and the term significance, which itself is either a statistical significance or a clinical significance. So these terms right now are like a shark in front of us as a small clinician. So why all of this is important is, without the knowledge of that, we have partial information. If you look at this photograph, it looks as if it's a giant bug which is from some Hollywood movie crossing across a city. So this is partial information. If we understand the four terms that I'm talking of, you would know the real picture. What it was just a cropped photograph of the bug on the windscreen of a car. So two absolute different situations. No, the real situation we came to know when we looked at the whole picture. So, like Siddharth told you about application of tests in a particular situation to get results. Now, let us assume that we have a particular article that has been given to us by a pharma representative or by a friend whom we are trying to, which we are trying to go through. Then for any study, there are a few basic points which are covered in any study. Most studies will try to estimate the magnitude of difference between a known therapy and some therapy which is new. So that is basically the first part of the study. The second part in the study should be to derive something called as a confidence interval. So if you have found out a difference between an old therapy and a new therapy, next step is to find out what is a confidence interval. The term I will explain later. The third thing is to find out something called as a p-value. The fourth thing is to judge what is the absolute magnitude of difference. That means if therapy A gave some clinical result, therapy B gave some other clinical result, what is the actual difference, the magnitude of difference between the two? And once you estimate this magnitude of difference, whether this difference was clinically significant for you. So these are things that should cross your mind whenever you are trying to evaluate an article, and analyzing each of the terms that we are going to discuss today is going to help us for that. So first off, we'll just understand a small concept called as null hypothesis in any clinical study. So I have a basic anti-glaucoma drug iotim, and now I come out with a different anti-glaucoma drug XYZ. Now, statistically speaking or scientifically speaking, you can never prove that the second drug is better than the old drug. That is not possible in science. You have to assume that both are equal and then prove that, or you have to assume that there is a difference and then prove that there is no difference. That is the only way that you can prove. That is proving the other way around. That is what is called as the null hypothesis. So whenever you are applying null hypothesis, you get something called as a p-value. So all articles that you will see for a particular difference or for a particular result, they would have mentioned a p-value. So what basically is a p-value? It is the measurement of probability. So let us say we say the p-value for a particular difference is 0.5. That means iotim reduces intraocular pressure by so and so units. Your new drug reduces intraocular pressure by so and so units. And the difference of this reduction has a p-value of 0.5. What it basically means is there is a 50%, 0.5 is 50%. There is 50% probability that the difference that you saw was by chance. So if anything is happening, it can be two things. Either it has happened because of the intervention or it has happened by chance, right? So if the p-value is 0.5, it tells us that you saw a difference between your iotim therapy and the new therapy, but there is 50% chance that this difference just happened by sheer fluke. So when 50% of times, that means when you're giving the therapy, 1 in 2 patients, the change is just by fluke. That means it is really not a great drug, right? It is just happening by chance. So what keeps happening if the p-value starts becoming smaller and smaller? Now you take another study where again these two drugs are compared, and here the p-value say happens to be 0.2. It tells you that there is 20% likelihood that whatever difference you are seeing is by fluke. So it is at least better than the first situation. You come down lower, if you have 0.05, it tells you there is a 5% chance that the whatever is happening by fluke. Look at the same sentence other way around. So between two therapies, if there is a 5% chance that the difference is by fluke, that means there is 95% chance that there is an actual difference, right? Now this sentence, that if the p-value is 0.05 or if the p-value is less than 0.05, whatever is happening is actually happening correctly. It is not happening by chance, is the crux of statistics. That means if while comparing two therapies, you can prove that the difference has a probability value of less than 5% or probability value of less than 0.05, you say that the difference actually exists statistically. So that is what is called as a statistical significance. A different term is something called as clinical significance, which the physician decides. I will tell you how that is in the later slides. Right, so this is what we discussed. Now coming to a concept of confidence intervals. We just saw what is p-value or probability value. Now second is something called as confidence intervals. Now I have put up an example here. So suppose you have 30 infants in a nursery in the city of Delhi, and you take the mean birth weight of all those infants and you find that the mean birth weight is 2.2 kg or 2234 grams. Now if I want to say that I want to know what is the mean weight of all infants in Delhi, so across all NICUs, so this is something which is practically difficult, right? There must be what, 500, 600 NICUs, each one might be harboring hundreds of kids. So how will you know the actual mean birth weight? If you want to know the actual mean birth weight, you have to take each and every child, you have to take the weight, you have to add them up and divide by the number of children, right? Pure arithmetic. But because you cannot do that, for simplicity, what you do is from that random sample, you take a smaller sample. So you take random babies from all nurseries all over Delhi. Let's say you have taken 30 babies and then take their mean. And then that mean comes out to be 2234. So you say, because I have taken this sample from the nurseries in Delhi, my interpretation is that the mean weight of the infants in the nurseries in Delhi is 2234. Now this sentence, one can by common sense say that to a certain extent it is right, because those babies were picked up from the sample in Delhi, but it is not exactly correct because it is not representing the entire population, right? So whenever you take a smaller sample from the bigger sample, for simplicity's sake, you will always have a possible error. That error is what is called as confidence interval. So I again give a second example. Suppose we want to know what is the mean age of the audience here, and say there are 50 of you. I only have 1 minute, so I cannot measure the ages of all the 50. So I just take 5 people here, and so interval basically expresses the likely error in whatever sampling you are doing. So I will explain these by certain examples. So once you do a particular clinical study, or once you read a particular clinical study and you find that there is a statistical difference that they are showing. So most common example that I would give is again a basic glaucoma drug iotim and a second anti-glaucoma drug which has come new in the market, and the pharma representative comes to you and says that drug is doing wonderfully well. We have done a very big study and we have found that the p-value is very significant. It is 0.0005. That is why the chance that whatever difference is occurring, it is occurring by fluke is very little. So you should really shift to this new drug. So one should step back and see whether whatever they are saying is actually correct or not. So how one goes about is one tries to see whether it is really clinically significant. So suppose you have a glaucoma patient whose IOP is 22. You give that patient iotim and the IOP becomes 16. Now there is this new drug. Again you give it to the same patient. His baseline IOP is 22. And this new drug reduces the IOP and makes it 15. Fine. So now 15 is less than 16. So if you take 200 or 300 such patients whose IOPs are around 22, 24 and give them this new drug and give them iotim, you will find that iotim is reducing, making them around 16, and this new drug is making them around 15. And then you do statistics and you will find that the p-value is coming as p less than 0.05. And we just studied in the previous slides that if p is less than 0.05, you call it statistically significant. So this is the amount of information that the pharma representative is going to bombard you. See, we have proven statistically significant difference, so the new drug is better. Now, the statistical significance, the test will tell. The clinical significance, you will judge. So now you will think, fine, my routine medicine that I use in my clinic is reducing the IOP to 16. This is a new drug. Its cost is probably 5 times more. Its availability is probably 3 times less than what is the availability of my routine drug. What will it do to the patient? It will reduce the IOP further. Further by what? By 1 millimeter. So, did this excite me? It is just reducing it by 1 millimeter. It is not that this new drug is making the IOP 10. So from 16 to 15, this clinical difference, is it worth for you to make that change, is what you have to decide. This is what is called as clinical significance. So clinical significance is something that the clinician decides, because everything, now this is an important line, everything that is statistically significant is not necessarily clinically significant. Statistical significance can be proven for even small changes, like the example I gave, 16 to 15. If you conduct the study over a large number of patients. So if you recruit 2,000 patients, 5,000 patients, even reduction of IOP from 16 to 15 will give you a very, very small p-value, which will become statistically significant and which will be told to you that it's statistically significant, so you should change. But you should tell yourself, hang on, how much clinical difference it has made. If it has not made much clinical difference, then the statistical significance is spurious. It is not of much value. So I will give 2 examples which I hope should make most of the theory that I spoke clear. Now this paper was published in 2013 edition of a retina journal by the name Retina. Now a long title, Visual and Anatomical Outcomes of Intravitreal Aflibercept. Now aflibercept is a medication on the lines of Avastin. Avastin is an anti-VEGF and aflibercept is what is called as a VEGF trap. So it works very similar to Avastin and it is supposed to be the latest in drug in the Western market. So in this study what they did is they took patients of neovascular AMD. These patients were injected with ranibizumab, which is Lucentis, and in spite of the injection there were patients who had persistent subretinal fluid. So these patients, that means post-treatment Lucentis, those who were not responding, they injected aflibercept, the new drug. And now they wanted to see whether there was a good outcome after this, right? So I'll just go to a table quickly. Now if you see, this table says visual acuity in logMAR baseline, 0.57. So this was the baseline visual acuity that the patient had. I will convert this into Snellen to explain to you further. And at the final follow-up, the visual acuity became 0.47. So when logMAR becomes less, the vision actually is better. So from a worse vision of 0.57, the patients improved to a vision of 0.47. And look at the p-value, 0.004. We just discussed that if the p-value is less than 0.05, the change is statistically significant. So this is less than 0.05. So it tells you that whatever change has occurred is statistically significant. So this part will be harped upon you by the medical representative. This is a new drug and this is the change that we have shown. The vision is improving, and see sir, see madam, the vision is becoming statistically significant. Even actually in the article, if you see what the authors are claiming, this is a line from the article which says a significant improvement in visual acuity was observed at 6 months. That means the authors are saying 0.57 became 0.47, which is a significant change. Now let us put what we said, confidence intervals. So for 0.57, if you use confidence interval statistical calculators that are available online, you will find that 0.57 actually can vary from 0.45 to 0.69 depending upon how many patients you take. If you take more patients, it can vary. If you take less patients, it can vary. So that 0.7's actual value could lie between 0.45 to 0.69. And the post-op vision, which is 0.47, its confidence interval can actually lie between 0.36 to 0.58. So if you see 0.45 to 0.69 and 0.36 to 0.58 is actually an overlapping range. So whenever confidence interval between pre and post therapy are overlapping, it basically tells you that there is no difference. So even if the p-value is significant, an overlapping confidence interval rules out any advantage of the new drug. Let us again judge it from a clinician's point of view. So this is a comparative visual acuity table that I have put up. Now if you see the logmar column of 0.5, so again the same example, the pre-treatment visual acuity was 0.57, the post-treatment visual acuity was 0.47, and the authors in the article were claiming that our therapy really worked. So what is 0.57? 0.57 means vision is between logmar of 0.5 and 0.6. That means it is between 618 to 624. Right? This is pre-treatment. Post-treatment 0.47 will lie between logmar of 0.3 and 0.5. That means post-treatment visual acuity in these patients was between 612 to 618. That means pre-treatment the patients were little worse than 618. Post-treatment the patients were little better than 618. So basically they are hovering around 618. So what has changed? Nothing has changed. But if you imbibe this therapy, are there implications for the patient? Yes, there are implications for the patient, because aflibercept 0.1 right now is not available in the Indian market. If it hits the Indian market, it is going to cost 1.25 lakh rupees, as against Avastin, which most of you would be giving anything between at 5 to 20,000. So that's a huge difference for the patient. So if you scientifically look at it, the new therapy is not doing anything in this case, and whatever the authors are claiming is actually spurious. It is false. So this is how you can interpret. Siddharth, am I short of time? Yeah, fine. So then I'll skip the second example. So basically what I wanted to say is statistics, you can see what you want and you can interpret what you feel. If you see both of these ladies are dressed differently, but each of the ladies feeling pity for the other lady. So whatever you see, you can interpret it the way you want. So whenever one is faced with an article or a clinical situation or a medical representative's references, one should always try to see first, before jumping to the p-value, what is the absolute difference. Like I gave you the example of the anti-glaucoma drug, 16 has become 15, or vision little more than 618 has become little less than 618. So see what is the absolute difference, then look at what is the p-value and the confidence intervals, and then decide what is the statistical significance. And whether you want to imbibe it in your practice or not depends upon what clinical significance you feel the medication is causing. Thank you for your patient hearing.